Welcome back to the second episode of Facts and the Future of Healthcare. This week, we're going to be focusing on why we haven't gotten any healthcare bills in the past, and more specifically, what those bills looked like. First, I want to hand it off to Zach to talk about socialized medicine and why that's a reason bills haven't passed.
Start talking about socialized medicine, we first need to look at the Great Depression and the bills that were passed in the Great Depression due to the fact that many families had less income to pay for healthcare. So Roosevelt, uh, President Roosevelt passed some legislation indicating that publicly funded healthcare programs. These these reforms, which would have free healthcare for most people due to the Great Depression and them not being able to pay for it for themselves, were attacked by the American Medical Association as well as state and local affiliates. And for the Medical Association, because they called it compulsory health insurance, and this never passed because of that attack by the American Medical Association. And Roosevelt ended up removing healthcare from the bill that gave provisions to many, many people in Great Depression in 1935. Fear of organized medicine became a standard for decades after the 1930s due to the rise of communism in Russia and other prominent places such as China. And because of this, many other hospitals began offering their own health insurance programs. So, the first hospital to do that became Blue Cross. Along with this, many groups of hospitals and groups of physicians would sell their services to employers for them as an incentive for people to come work for them, because they would get free healthcare from their employer. This practice originated in the 40s. And in the 40s, Congress also passed legislation that Congress passed legislation that officially made all of those third-party insurers legal. And during World War II, an industrialist named Henry J. Kaiser, you had one such group of physicians and hospitals helping his employees and and all these physicians were contracted to meet the medical needs for all of his employees for all of his construction projects, then any injuries that might occur. In the meantime, after World War II ended, this program was opened to the public as a non-profit organization, which we now know as Kaiser Permanente.
That's really interesting, Zach. That's really cool to hear. And the reason why these major bills haven't passed is because of lobbying. Brendan, could you help us better understand what lobbying is and how they affect these types of bills?
Yes, Isaac. So in politics, lobbying, persuasion, or interest representation is the act of lawfully attempting to influence the actions, policies, or decisions of government officials, most often legislators or members of regulatory agencies. And also, many of these healthcare bills are the target of large corporations' lobbyists, spending lots of money to ensure that the business is not lost in the passing of these bills.
That was really intriguing, Brendan, but there's one last piece of the puzzle that we need to fit into this whole picture. Take it away, Charles.
Will do, Isaac. So, something that we really need to acknowledge to fully understand why we don't have healthcare in this country is the impact that Calvinism has played in our culture. So, Calvinism is a denomination of Protestant Christianity, and in that culture, humans are affected with sin, and we have to try and get rid of that through God. And there was a certain type of people called the elect who were basically predestined for heaven. And and people would work very hard through good deeds to prove that they were part of the elect to other people. And this was kind of that they thought they were a member of the elect, but it was more like prove to others that they were. And this would look like frugality, not engaging in vices, having a good work ethic, all of that. It's basically slowly evolved over time to eliminating more of the religious aspects of this and leaving behind a deeply entrenched culture of basically means testing. So those who deserve aid already have them. And the concept of the deserving poor, the poor who deserve housing. Continuation of this has led to a very strong culture of people thinking that if you don't have healthcare already, like if you can't afford it, that means you're doing something wrong and it's your fault, not something systemic. And so that you don't deserve it because you're not working hard to even myself as someone who is not um is not Christian at all, um it still has remains of this growing up in this society. um so the thing is, the core beliefs of this doesn't have to remain to leave the culture behind. The original, like the principle of the elect withered behind, while leaving this individualism that we often hear talked about in American society. And that is where this concept of merit is very American, and is descended from Calvinism, really. Thank you so much for listening to this podlet, and I hope to see you next time on the third and final episode of Facts in the Future of Healthcare. Bye.